Hi, my name is Debbie, and today I want to talk to you about borderline personality disorder and how it affects adolescents. But let me first give you some background information on how this all sparked my interest. One day, as I was working my practicum at a level 14 residential group home for females, the weather was not nice outside, so we decided that we were going to bake cookies and icing and just generally have fun. So we were sitting there, the music was going, we were laughing, and then all of a sudden one of the clients gets up, throws icing on the floor, starts hitting the walls, and runs in her room and slams the door. Come to find out, she started possessing self-harming behaviors. I witnessed this client go from baseline behavior all the way to the extreme. So it got me to thinking, these clients with borderline personality disorder who are effective, what kind of therapeutic tool would best fit this population? So, what is borderline personality disorder? According to Lev et al. Within the Lancet, borderline personality disorder is characterized as an inevitable and reoccurring instability that affects one's ability to control their impulses as well as their self-image and their relationships with others. These behaviors are often demonstrated through spontaneous aggression as well as impulsive and frequent self-harming behaviors. Through my research into borderline personality disorder, I found a therapy created by Dr. Marshall Linehan named Dialectical Behavior Therapy, or DBT for short. DBT, as outlined by O'Connell and Dowling in the Journal of Psychiatric and Mental Health Nursing, is a complex therapeutic tool which lasts approximately 1 year and is based on the premise of changing one's behaviors within the borderline personality disorder through the holistic healing of emotions and behaviors through acceptance and change. Dialectical behavior therapy is closely related to another therapy known as cognitive behavior therapy. However, dialectical behavior therapy is diversified in that it focuses on one's ability to actually learn new skills. So my question to you today is this: if dialectical behavior therapy is an effective treatment tool in treating adolescents who are diagnosed with borderline personality disorder. So, what is the theory behind dialectical behavior therapy? We know dialectical behavior therapy is a cognitive approach which emphasizes the psychosocial aspects of treatment. The theory behind dialectical behavior therapy is that some individuals are prone to react in an out-of-character manner towards certain emotional situations or stimulation. This theory suggests that some individuals' arousal levels can increase much more quickly than the normal person and attain a much higher level of emotional stimulation and takes a significant amount of time to return to baseline. So, dialectical behavior in itself has its own characteristics. There are three characteristics behind dialectical behavior therapy. The first is support-oriented. Support-oriented helps an individual identify their strengths and builds upon them so they feel better about themselves. The second is cognitive-based. In this, one is able to identify their thoughts and beliefs and assumptions and the patterns that they currently have going on, which makes their life harder. An individual within this, the dialectical behavior therapy, learn to readjust their way of thinking. So instead of saying, I'm not perfect, therefore nobody can ever love me, it changes to, I'm not perfect and that's okay. Or anger is an emotion that everybody experiences. There's also collaborative. This is when the client gets constant attention within their relationships. During the therapy relationship, individuals are encouraged to work out their problems through homework, role-playing, and self-soothing techniques. DBT also has its own components. The first is individual weekly psychotherapy sessions. During sessions, therapists actively teach and reinforce adaptive behaviors, especially as they occur within the therapeutic relationship. The emphasis in teaching clients is how to manage their emotions, their emotional trauma, rather than reducing or taking them out of the crisis. So even if the client is in the middle of a therapeutic treatment and he's in the middle of a crisis, we are going to work through the crisis. Component number 2 is the weekly group sessions. These are generally a session with all clients with borderline personality disorder and where they learn skills from the 4 different modules within DBT. These are interpersonal effectiveness, distress tolerance, emotional regulation, and mindfulness. The third is phone consultation. No matter any time that a client within the DBT therapy is needed to talk to their therapist outside of their normal weekly time, this provides the clients with in-the-moment coaching on how to use these skills to effectively cope with the ever-difficult situation they are currently in. Now, there are 4 modules within the dialectical behavior therapy: mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation. So mindfulness is the practice of being fully aware and present in the one moment. In this, one is able to be aware of their emotional state and their immediate surroundings. Mindful attention focuses on the now, not the past, not the future. The aim is to observe without judging or trying to fix the current state. Interpersonal effectiveness is the second one. Now, borderline individuals typically possess good interpersonal skills in a general sense. However, they are unable to apply these skills in specific situations. This module focuses on situations where the objective is to change something or resist changes that someone else is requesting, such as saying no. This skill is taught to maximize the goals one has within specific situations while also not damaging their interpersonal relationship or their self-esteem. The next is distress tolerance. This skill constitutes a natural development for mindfulness as it is based on the ability to accept in a non-judgment fashion one's own self or the current situation. Distress tolerance behaviors are concerned with tolerating and surviving crises while accepting life as it is now, in this moment. There are 4 sets of survival strategies: distracting, self-soothing, improving the moment, as well as thinking of the pros and cons. The last is emotional regulation. The dialectical behavior therapy skills for emotional regulation include identifying and labeling the emotion, identifying the obstacles that is stopping you from changing the emotion, reducing one's vulnerability, increasing the positive emotional event, taking opposite action, and applying distress tolerance techniques. So, in conclusion, while borderline personality disorder affects one's impulse control, self-image, and interpersonal relationships, research has shown borderline personality disorder as an instability within an adolescent's daily life. This is shown through the display of emotional instability, spontaneous aggression, as well as self-harming behaviors. Linehan's premise that complex therapy lasting approximately 1 year would enable adolescents to be able to minimize their behaviors as well as a holistic belief of acceptance and change. Now, throughout my research of borderline personality disorder, the behaviors displayed, as I showed you in the beginning with what I saw, such as this aggression and self-harming behaviors, they were significantly reduced with DBT, while their interpersonal relationships and self-image was greatly improved. Through my research, I found that dialectical behavior therapy is a positive and effective therapeutic tool which give adolescents the coping skills needed to understand their feelings and their behaviors, as well as the skills to minimize their acts of aggression and their acts of self-harm for years to come to live their best life possible. Thank you.